You're in mute, Vivek. You're in mute. Yeah.
Hi, good morning, friends. I hope everything is audible. Can we start? Yes. Hello. Is it audible, boss? Fine. Good morning, all, for this morning session. It's very nice to see a lot of people really interested and waking up and here for the class. When I was planning something for the class for psychiatry, actually when we see questions, okay, when you see question papers, the questions can be, psychiatry is a minor subject, so you can see that the classical pattern is either they will ask you who gave so and so psychoanalysis, or who gave some concepts, or it will be some topics on schizophrenia, or it will be on drugs. But in the recent years, when you see, examiners tend to ask about psychotherapy. Okay, so I thought why they ask about psychotherapy is because the examiners feel that, okay, students know only like what are the 4 A's given by Bloiler, or what is that, who gave the term schizophrenia, only those terms, these students are known only about these things. So let us ask more about therapy or more about treatment. So when we have good knowledge about psychotherapy, it will be useful for you. So we are going directly into the topic. What I divide this topic into 2 parts, okay, today and tomorrow. So first, what is psychotherapy? You know what is pharmacotherapy. So what is psychotherapy? It's good that we are having an interactive session. What do you know about, what do you think is psychotherapy? Counseling. Good, Paul Sanji. So psychotherapy is nothing but, as you give medicines, as medicines goes and changes once, first messenger, second messenger, third messenger symptoms, you do something which is non-pharmacologically, which will produce a change in person's emotions, thoughts, or behavior. That is called as psychotherapy. Okay, now as most of the questions are repeated in this, I'll go in a particular order. First and foremost, you have any idea about any type of psychotherapy? Because 1 to 2 questions are repeatedly asked on one particular topic. Apart from that, you have any idea? Excellent, Dr. Shiba Priyadarshini ji. It's CBT. Excellent. I think when we are giving our final exams, we'll be knowing about the CBT, because whatever the question they ask, we'll give CBT as answer. First and foremost, that you should all know, one therapy is psychoanalysis. What is psychoanalysis? Any idea? Any idea what is psychoanalysis? Any thoughts? Okay. So what you should know about psychoanalysis is, who is the father of psychoanalysis? It's a form of therapy. Okay. Who is the father of psychoanalysis? Second, what is it? Only these 2 things you should know. Father of psychoanalysis is Sigmund. Excellent, Sanjeev ji. You're right. It's Sigmund Freud. See, in older times, okay, what happened was, people were thinking that when a person is behaving in a hard way or behaving in a different way, okay, they didn't think that this is a psychiatric disorder or this mental disorder. They thought that, okay, these people are possessed by demons or spirits, and they were doing all sorts of treatments. Only after Sigmund Freud, okay, after the brilliant thought of Sigmund Freud, people started to believe that there is something happening inside the mind, okay, because he feels that all these problems, all these change in behavior is because of some change in the mind. So if you want to really understand what is happening, go and analyze the mind. Okay, so that's why it is called as analysis of the psycho. Psych means nothing but mind. So analyze the mind, because that is where everything is happening. Okay, that's where he gave what is called as psychoanalysis. He gave one technique which is called as, you all know what is one stage of development given by Sigmund Freud? Excellent. Theory of psychosexual development. Back to those stages. Excellent. Oral fixation. Wonderful. Oral fixation, anal fixation, etc. Sanjeev Padmanabhan. Wonderful answer. Can you tell me what technique that he gave? There is one technique that he was given by him, which is called as couch technique. Couch technique was given by Sigmund Freud. You know what is it? Excellent. What do you mean by free association? Very good. What is free association? What do you mean by couch technique? What do you mean by free association? Any thoughts? These are the words that you should know. Free association, feeling, speaking freely and restricted. Excellent. What happens is that there will be a sofa. Okay. And what happens is that the patient lies down. Okay. And what happens is that here the therapist is going to sit behind. Sigmund Freud used to sit behind the sofa and the couch, and the patient keeps on speaking. What the patient speaks is freely unrestricted. That's right. But actually, what is the words that was actually used by Sigmund Freud is you should talk anything from cabbages to kings. Okay, you whatever that comes to your mind, you need to speak. Why you need to speak this much freely, or you need to, like, what is it? It's not on a particular topic. You can say whatever that comes to your mind. It's because after some 2 to 3 or after some 4 random thoughts, any thoughts that comes automatically will have some connection to your unconscious, and that will help the therapist to understand what is happening in the unconscious, which results in the present problems. That is called as free association. Please concentrate. Free association is a very, very important word that is most commonly asked, and couch technique was given by Sigmund Freud. And another thing that you should know about this technique is that whenever the patient lies down and the patient keeps on speaking, the patient often says that, sir, I had this type of dream, because he met a lot of people saying that there is some disturbing dreams that's happening, which made him to do a lot of research into it, after which he gave what is called as interpretation of dreams. Okay, this is a book that was written by him, and that gave him a very good conclusion about what is happening in the unconscious mind, which will help him to understand the patient better, which will help the patient to get treated better. Apart from this, you know that Sigmund Freud is the father of psychoanalysis, couch technique, free association, and also psychosexual stages of development. Apart from that, recently 2 questions that is most commonly asked is transference and counter-transference. Can you tell me what is this difference, or what is this basically? What is transference? What is counter-transference? Any thoughts? Affection of a patient towards counselor, patient's unconscious towards therapist, and vice versa. Excellent. What is transference? Projection. Okay, fine. Okay. What is transference? From patient to therapist, what is it called as? Excellent, excellent, Vishnu Balaji ji. What is transference is nothing but, as told, this is a doctor. Let's have, this is a doctor. This is a patient. Okay. So what happens is that there will be a, what is this? Is nothing but, it is an unconscious direction of feelings. Okay, this you should have, as you start, if you are a person who's really interested in psychiatry, you tend to see patients. Okay, with just one session. Okay, well, just one session. We used to just do in CMC Vellore when I was trained. You know, it's like, it's all about therapy. You sit there from morning 7 o'clock to night 11 o'clock with the clients, and we'll be able to just give only a few sessions for outpatients, because it will be all of inpatient care. So only one session, and the patient comes out with the next visit, with coming and saying, sir, you are really brilliant. You're the best doctor in the world. You are giving wonderful care for me. I never seen a doctor in this world. I used to understand what is happening. I didn't do anything. I just gave support to therapy. I just supported her. That's it. But why the patient is giving this much, positive appreciation? That is called as transference. Similarly, when you do continuous therapy for inpatients, you give regular planning, you make sure that the patient is given regular sessions, regular time slots, and sometimes you might have another research work or academic work. and tell the patient that this today's slot we are postponing for 30 minutes or 40 minutes, the patient will go and complain to the head of the department saying that this doctor is showing too much of attitude. He's not giving too much attention to me. Please change the therapist. I'm not interested in. So basically what happens is that these patients, okay, it's as Sanjeev ji is saying, they have some unconscious direction of feelings because they had some problem with the authority figures, some problem with the superiors, which they will show it on to the therapist. Okay, they don't do it consciously, and when you see it, it's called as it is useful in therapy. Okay, initial times when Sigmund Freud was doing therapy, he felt that no, you should not, when there is transference, or when the opposite, when there is counter transference, you should be very careful. But in recent times, what is in today's research, what they're saying is, when there is transference and counter transference, it will help us to understand how the patient, for example, if the patient is having some feelings towards me, similarly, the patient will have similar feelings towards others who are close to them. So that will be useful. The understanding this feeling will be helpful to understand the patient better. Okay, that is what is present researches. And I suppose this is a very recent question. That's why it is repeatedly asked also, transference and counter transference. As I told you again, there will be a therapist and there will be again a patient, and doctors are also humans, right? So they will also have human minds. So then actually we are also subject to feelings, and this is called as there is a direction of feelings from the therapist to the patient is called as counter transference. Okay, please, it's very simple. It's very simple. A patient having a feeling towards a doctor is called as unconscious. You are not having, say, a conscious feeling. Okay, it's an unconscious direction of feelings. It's called as transference, and it is from the therapist to the patient is called as counter transference. What we were taught is that when a therapist is sitting for a therapy, or when a therapist is ready for a therapy, before that he need to be sorted out. He need to be first analyzed. Okay, we call it as psychoanalysis or analyzed first. Okay, why? Yes, excellent. Why you should be analyzed first? Because when he is clear, or when he is analyzed, and when he knows his limitations or problems, the counter transference doesn't occur. Second thing is that every session we need to write it down and we need to discuss with the superior, so that if there is any counter transference that is arising in therapy, or the any unconscious direction of feelings that is happening, when it is shared with the therapist, the superiors, they will guide you, because they are not directly involved in therapy. So if there is any counter transference, it can be again useful. Okay, with the client and also with the doctor. So these are the things that is most commonly asked. So there are, we usually say the famous 5. So couch technique, free association, father of psychoanalysis, transference, and counter transference. Any doubts here? Any doubts? Any doubts? Clear. Good. So I'm going to go to the next famous word that you all know, CBT. What is CBT? What is CBT? Cognitive behavioral therapy. Okay, BT means behavioral therapy. So cognitive behavioral therapy. Who gave cognitive therapy? Who gave cognitive therapy? Any idea? Excellent. Oren VIVEK. Now, what you should know is Oren VIVEK's most important contribution is excellent. Sanjeev ji, he died recently. Or one of the important contribution of Oren VIVEK is he gave a triad. What is this triad? Excellent. CBT is a wonderful mode for treatment for depression. Accepted. What is the triad of depression? Beck's triad of depression. Excellent. What is the triad? Helplessness, worthlessness, hopelessness. Wonderful. It is nothing but negative view of oneself, negative view of others, negative view of negative view of oneself, negative view of others. Excellent. Negative view of future. I have a negative view of oneself, which will result in worthlessness. I feel nobody is going to help me from this situation, so I'll feel helpless. I feel that nothing is going to change in the future, so I'll be hopeless. Okay, so basically, as Sigmund Freud thought that you need to analyze deep into the mind, these people or the RNT thought that why don't we change the cognitions? Okay, you gave basically cognitive therapy, then they added the behavioral therapy component also and gave the famous cognitive behavioral therapy. Okay, you're all clear with this. Who gave the triad of depression is RNT Beck, and the CBT is a very important and famous mode of treatment for depression. If it is a very severe depression or if it is a moderate to severe depression, we go with drugs with therapy. But if it is mild things, we'll definitely go only with what is called as counseling or CBT. Now, I'm going to add some new few components of CBT. I think you should have known by this time. One is called as REBT. Another is called as DBT. What is this? It's good that you're all interacting, because if I see people interacting, it will be like motivating me also. Good. What is REBT? What is DBT? Any thoughts? Rapid emotive behavioral therapy. Okay. Okay, fine. Any other thoughts? Any other thoughts? Any other thoughts? Rational emotive behavior therapy. Anybody has an idea? Rational emotive behavioral therapy. Any idea who gave this? Excellent, you're right. REBT was given by yes, Ellis is right. What is it? A. Albert Ellis. What is this rational emotive behavioral therapy? Okay, he gave two components of there are multiple components. It's a therapy per se, but two things that is you should know is, one is that he said A, B, C. Okay, there is, everybody says no, whatever is your thoughts, that will happen. Okay, whatever is your thoughts is very, very important. You need to concentrate on your thoughts, because thought is everything. Okay, there's from the old Buddhist concept, even today it's standing true. Now, what they say is, whatever happens in the world, or whatever worst that happens, or whatever that good happens, what you feel about it, what you believe about it, or what are the thoughts that comes after it is all what matters. Okay, what they say is anything can happen. It can be a good thing, it can be a bad thing, activating stimulus. It can be anything. What is after that stimulus has happened? What is your belief or what is your thought is very, very important, because that will help or that will result in a consequence. It can be an action, or it can be a speech, or it can be a word, whatever it is. But what they say is, what something happens and the immediate thought that comes or the belief that I have is always very important. That's what is the crux of cognitive therapy. Okay. Another wonderful word, okay, which I use it in my life, which I try to use it in my life, is you should avoid must and should statements in your life. What is this must and should statements? I must be a winner in all my life. I whenever sees a consequence. Dr. Sharon Saktivel sees consequence. I for example, today I sat here and the laptop is not working and I feel bad. Okay, so the belief system is nothing is working for me. It's like whatever, whenever I'm opening like this, in a Zoom meeting, all this is happening. So the belief that's happening or the thought that's happening, and I'm feeling very irritable or distressed, that's a consequence. Okay, that is an activating stimulus. What is the belief and what is the consequence? So must and should statements, I have seen a lot of times, even when we do in therapy, there is a lot of clients who are functioning well, but sometimes they become what to say bit irritable, or they get, what we say is that they don't maintain the gains that is made in therapy, or when they go to the real world they lose something, is because they have something in their mind that is called as must or should statements. I must be a winner, or I must whatever I do I should get big things. It keeps a very big demand on yourself, or it gives a very big stress on yourself, which weakens you. Okay, it acts as a stressor. So that is what was given by Albert Ellis in REBT. Is it any excellent? It's a good question by Sanjeev Padmanabhan. Actually, what happens is that anal fixation is what he says is OCPD, obsessive compulsive personality disorder. Actually, what happens is that obsessive compulsive personality disorder people, you know what is OCPD, right? Everybody knows what is OCPD. Yes, so that's good. OCPD is nothing but they are persons who are very strict. They are punctual. They are persistent. They want everything to be right. Okay, you have in your UG times there will be a person who is very strict, but will be very punctual. For if you're 5 minutes late, he gives a very dirty look and he says that you should go outside and stand outside. So they expect everything. Okay, they make rules, they follow rules. Okay, so they might have some components. Any person who's very having OCPD will have components of these should. Okay, they are very strict, no? So they form rules and they also follow the rules. But what happens is that anal fixation is is something which is related to OCPD directly, but not with this must or should statements given by Albert Ellis. Okay, you're right, because OCPD is always forms rules. Okay, that is very, very important. Good. Anybody know what is DBT? DBT. Dialectic behavior therapy. Wonderful. You're making my work very easy. Who gave dialectic behavior therapy? Another question. Who gave dialectic behavior therapy? Halle Bruce. Okay. Anybody? Any other words? Any other thoughts? Marsha Linehan. Okay. See, boss, OCPD is nothing but okay, great, Vinod Kumar. It's Marsha Linehan. Dr. Prasad Raj. OCPD is nothing but, okay, I'll just write it here. OCPD is nothing but these people, it's a type of a personality where the person will be punctuality, persistent, and they will form rules, they will follow rules, they will expect everybody to follow. Okay. Okay, so this is what it is, very characteristic feature of OCPD. There will be a lot of questions that you can see in assessing a person who is very punctual, persistent, and he's very stubborn. So what is this personality, or which cluster that personality fall into? Because basically it will fall into which cluster? Which cluster? Excellent. So it will fall into cluster C. What is the other name for OCPD? What is the other name for OCPD? Excellent. Anachastic. So basically, they, as any person who forms rules will definitely have that I should follow rules, I will follow rules, and I must expect, and I must expect the same from the others. So those people might also follow this should and must statements. That was the question. So I just told that as a relevance. Okay, so let's coming to the DBT, dialectic behavioral therapy, which was given by Marsha Linehan. For whom it is used? For whom it is used? Is there any particular clients that we can use this? Where it is used? Excellent, Vishnu Balaji. It is used for borderline personality disorders. It's also called as UPD, emotionally unstable personality disorders. Have you seen any times or have you read about emotionally unstable personality? By this time you should have read. What is that? What do you mean by emotionally unstable personality disorder? We at times also have unstable emotions, but these persons have it as a personality per se. What is this borderline personality, which is also called as emotional unstable personality disorder? Any idea? What are the characteristic features? Any thoughts? Any characteristic features? Any thoughts? Anybody? Any thoughts? Why sudden silence? Okay. So basically, insecure. Excellent, Sanjeev Padmanabhanji. They are insecure. Yes, very good. Any other parts? Impulsivity. Wonderful. Mood swings. Wow, great. So you were typing all this time. Good. Excellent. So basically, what happens is that one characteristic thought. Okay. Unstable relationship. Wonderful. What happens is that, see, they have what is this called as black and white thinking. Okay. Distress intolerance. Excellent. So they have something called as black and white thinking. Okay. Either you are my best friend or you are my worst enemy. There is nothing called as in between. Okay. Okay. People see, for example, either you should like my class. You say that, sir, it's a wonderful class, or you say that sir, this is the worst class I have listened. There's nothing called as, sir, you can improve on this. You can, these are the things that you should have changed. No, I can't take that. It means that you're not, no, either you like it or you don't like it. There's nothing called as gray in between. Okay. That is called as dialectic. Dialectic means giving an opportunity where there is a chance of opposites to exist. Okay. That is called as dialectic behavioral therapy. Actually, Marshall Linan did a wonderful research. You can go to YouTube videos and look into after your exams. Okay. Go into and understand what is happening in her sessions. Actually, these patients have emotional dysregulation. That's why it's called as emotional unstable personality, and they have a lot of suicidal attempts, and they peak of emotions. It's like what we call it as UPD is called as burnt skin. Okay. You know what is burnt skin? See, what happens is that when you have a skin is very protective. Okay. When in a patient with the burns, what happens is that a small, okay, with a small, like when there's you need not touch it. Okay. Even a small amount of air, okay, will make it give a little increased pain. Okay. Similarly, these patients will have increased emotional outburst or emotional reactions. Okay. These patients might be seen or might have increased reactions which will present as emotional outburst, and because of that, people who are with the patient will have interpersonal problems. Okay, they feel that what is this happening with this person is sometimes giving me increased affection, sometimes the patient is not at all giving me affection at all, not at all even looking into at me. It is called as emotional unstable personality. You can see a lot of movies, which comes into these traits, UPD traits, because they are all very famous people, and also these people will have a lot of problem with their interpersonal relationships. So Marshall Linan feels that the patient should able to see the opposites and keep the opposites, and also where both exist. That is what is called as dialectic behavioral therapy. Okay, is it very clear? Okay, so CBT was given by Orrin T. Beck, REBT was given by Albert Ellis, DBT was given by Marshall Linan. CBT was given in depression. Okay, it works on automatic thoughts. All automatic thoughts that comes to my mind, I just work on it. Albert Ellis works on ABC. What is A? What is A? What is A? Activating stimulus. What is B? What is B? Belief. What is C? What is the C? Consequence. What they say is just don't look into the consequence. See what is happening, the belief. Try to change what is happening, the belief. Things will be a lot better. And again, another thing is that must and should statements in a person's life can be avoided. Okay. Next comes DBT, which was given by Marsha-Lennon, and Marsha-Lennon gave it for which patients, which group of patients? Which group of patients? UPD, emotionally unstable personality disorder. Emotionally unstable personality disorder falls into which cluster of personality? Excellent, excellent. Cluster B. Can you tell me other cluster? No. Cluster B. Please concentrate. Cluster B. Cluster B. Cluster C is only 3. Cluster B has 4. What are the 4 cluster C personalities? Antisocial, narcissistic, histrionic. One thing is missed, which is UPD or borderline personality disorder. Any doubts? Can we proceed further? Are we going in a correct speed? Yes. Now, one question that is most frequently asked. Okay, most frequently asked. Nowadays, when I expect a psychotherapy question, I expect this question is nothing but ERPT. What is ERPT? Where it is used. That's all you should know. What is ERPT? What is ERPT? Exposure and response prevention therapy. Exposure and response prevention, which is used as a therapy. It is used. Where is ERPT used? If a question is like this, you should always search for the option of OCD. Always search for the option of OCD. Okay. Okay. Now, what is this? What do they do is, you know what is OCD, right? Everybody knows what is OCD. Yes, yes. What is your doubt? Somebody has raised hand. Yes. Is there a doubt? What is OCD? Hello. What is OCD? Any thoughts? Why sudden silence? What is OCD? People are typing. Obsessive compulsive disorder. There is an obsessive compulsive disorder. Okay. What is obsession? What is obsession? Doing things repeatedly. What Gunesh Shekharanji is saying is compulsion. You do a same activity again and again. What is obsession? Obsession thoughts, compulsive action. Possession of thought. Excellent. Wonderful point. Shiba Priyadashiniji. Wonderful. Repetitive thoughts, obsession. Any thought which is repeated, irresistible, and very importantly, irrelevant, intrusive thought is called as obsessive thought. And to overcome this obsessive thoughts, a person does a behavior that is called as a compulsive behavior. More or less, it's like an act. So it's what we call it as in UG teaching is obsession is a thought. Some thought is coming. To overcome that, I'm doing an action that is called as a compulsion. For example, I feel that, oh my God, my hands are dirty, or I might get infection. So I'm very anxious about it. So what happens if my hands are dirty? What if my hands are carrying some germs? So I have this obsession. So I keep on when there is an obsession of contamination, what will be my compulsion? What will be my compulsion? What will be my compulsion? Excellent. Washing. Now what you're going to do is, now after the compulsion, my anxiety will come down. but after some time it will again come again. Okay, it will be going on like a circle. Now what we are going to do is we are going to just cut the circle. Very simple. So here you are going to expose the person to dirt. Okay, ask the patient to touch a toilet seat or a sink. Okay, and the patient will have an irresistible desire to go and wash because he feels that, okay, my hands are dirty. Now the patient is not allowed to go and wash. Okay, so what happens is that there will be, as time goes, the anxiety will keep on building. But as time goes and as you're not permitting, the anxiety gets plateaued and the patient understands that, okay, nothing is going to happen, and slowly the anxiety will fall down. Okay, so what you're going to do is you expose the patient to dirt and you prevent him from washing or do the compulsive behavior, thereby help him by doing a therapy is called as exposure and response prevention therapy. It is used in OCD. OCD is nothing but obsessive compulsive disorder. I'll just ask one word. What is the brain structures that is involved with OCD? Excellent, Sanjeev. We are going to go to systematic desensitization, the next part. I'll come again. Articostriatothalamic. My goodness, what is this? Vishnu Balaji. Excellent. Articostriatothalamic. What I used to remember as a mnemonic, OCD. Orbitofrontal cortex. Caudate cingulate cortex. Okay, as this was recently asked in one of the INI question papers. Okay, good. Are you all with me? So I've told you about psychoanalysis, Sigmund Freud, transference, countertransference. Do not forget. Next, I told you about three things: behavioral therapy, RNT-Beck, REBT, Albert Ellis, and DBT was given by Marshall Lennon. Next, we came with ERPT, exposure response prevention therapy. Next, are you all with me? Are you all with me? Can we go further? We have another 20 minutes. Yes. Next, we are going to call it as EMDR. What is this? EMDR. What is this? Any thoughts? Any thoughts? By 6:55, we'll go to questions. Okay. Excellent. Eye movement, desensitization, and reprocessing. Where it is used: post-traumatic stress disorder. Post-traumatic stress disorder. Yes, I know what is post-traumatic stress disorder. See, I am having an exam tomorrow. Is it called as after the exam I feel very bad? Is this post-traumatic stress? No. I proposed a girl. She said no on my face. Is it a post-traumatic disorder? No. I went. Well, then what is called as post-traumatic stress? That's very important, because near death, either you witness near death or you are have faced it particularly, and also very, very importantly, important life events like rape, in wars. Okay, where it's like life or death situation, where you're put in a very tough situation like that. It's called as, it will be categorized into what is called as post-traumatic stress disorder. What is the difference between adjustment disorder and post-traumatic stress disorder is that, rather than just worrying about it and a small negative components, a small feeling restricted, not moving alone, one thing that they have is called as flashbacks. What is this flashbacks? Excellent. Excellent, Pavitra Duraraji. Flashbacks. Flashbacks is nothing but, flashback, right? in movies and all you would have seen. Okay, some hero will be around 25 years. What happened in 10 years is they will show what happened in 10 years. That reel will come. Similarly, some accidents or something has happened, which is very important experience for me, and I feel that it is happening now. Okay, it will come as images. I'll be seeing it as if it is happening now. Now, what I'm going to do in ERPT, EMDR, eye movement desensitization reprocessing, is that with just movement of your eyes, okay, we'll be just moving your eyes. As it's more of like a training. With the movement of eyes, we'll try to convert your stressful or what to say trauma images to, okay, your brain is full of images, right? So the trauma images, you'll be converting those images to something called as a neutral image. And sometimes if the patient is more cooperative, we'll change those images into positive images. Okay, so basically with the just movement of the eyes, you are just desensitizing the patient, and reprocessing into a more neutral or a positive image is called as EMDR, eye movement desensitization reprocessing, most commonly asked question. Now, as Prithvi, I think that was the doctor who asked me some question. There are, for phobias, what is the treatment? For phobias, there are two treatment. One is systematic desensitization. Another is excellent, flooding. Good. Now, what is systematic desensitization? Anybody has an idea what is systematic desensitization? Flooding, systematic desensitization. Phobias, that should be in your mind. Yeah. What is systematic desensitization? There are pretty graded exposure, slow exposure to triggers. Excellent. What we make is, okay, as we have worked in patients, what we ask is, we'll make a ladder. And this ladder is called as fear ladder. Anybody has simultaneously increasing the exposure? Yes. Now, what we are going to do is, we'll in the therapy, you'll first sit and make a fear ladder. Let us take a patient is having a phobia for cockroaches. Now, what we are going to do is, first we'll make a fear ladder. What is this fear ladder is? The patient is having less fear if he sees the image of a cockroach. Okay, there is an image, and this is a cockroach. And the ultimate fear is the cockroach is in his hand. Okay. Now, what we are going to do is, we have made a fear ladder. Now, what we do is, along with each step, you will teach him what is called as a breathing exercise. Breathing exercise means what happens in breathing exercise? Basically, whenever there is a phobia, there will be increased sympathetic drive. Whatever you do a breathing exercise, what is breathing exercise? Deep inspiration, deep expiration, thereby giving your phrenic nerve activation. So the vagal center, so cardiac, slow down your heart rate. So basically, you are giving a parasympathetic mimic. Okay. So basically, you expose them to stimulus of which is fear for the patient, and also give a breathing or relaxation exercise. And once the patient feels comfortable in that stage, slowly go to the next step. For example, here, image of a cockroach. Second, image of the cockroach in hand. Third step would be cockroach put in a corner of the room. Okay. Slowly you expose, and each step you give a breathing exercise. Okay. It's nothing but sympathetic activation is also there. You do a breathing exercise. Parasympathetic relaxation is also there. So we are doing it simultaneously and slowly grade it, and finally reach the step that is called as systematic desensitization. What is flooding? What is flooding? What is flooding? Before that, who gave systematic desensitization? I forgot to ask that question. Who gave systematic desensitization? Who gave systematic desensitization? What will be? Joseph Wolpe. Next, what is flooding? Flooding is very nice thing, See, you all know swimming, right? So what happens is that, okay, in villages and all, if there is a person who wants to learn swimming, what they will do is there'll be a person, an adult person there in outside the well, and there will be a person inside the well, okay, who knows swimming better. Now there is a small boy who's saying, "Oh, you know, I won't go and like jump into the well and all. I will die. That's it. Nothing will happen. I'm not doing all this." And what happens is that they will not get like what to say prior consent. Person is inside the well. The small person or a person who is fearing swimming is inside the well, or fearing water is inside the well. Now what happens is that because of the lung, naturally will after some time you will be coming out, and naturally you have to just move your limbs. So what happens is that once the patient knows that okay, this is not a very big deal, the fear will go, and the fear component, they say no, everything is in their mind. Once they get exposed, things will be a lot better. Okay, so when the fear component goes, they will be able to do it better, because of all these times the things that was restricting them not to do any action was a fear, and once the fear is out, it's not going to be there. But only thing is that you should be very careful, because it will burn your fingers at times, because you should be doing it only in patients who are half motivated, because once you do it, okay, in a flooding manner, and people feel it as it as a very traumatic experience or threatening experience, it might be very much difficult to help again. Okay, it will take up a very problem again. Okay, so that is called as flooding. Yeah, that might itself become a very big trauma or something. Okay, so this is the two components that you should know. One is systematic desensitization and another is flooding, which is used for what disorder? Phobias. Next, I'm going to talk to you about panic disorder. What is panic disorder? You all know what is panic disorder, right? What is panic disorder? Any thoughts? We are more some 7 minutes. Sudden anxiety attacks. Excellent. They are people who come to casualty saying that, sir, I'm having an attack, do something. Okay. So basically, when people are evaluated, we will be seeing that everything looks normal, but they will be having this panic attack, okay, panic disorder. Okay. What are the organicity or what are the medical causes that you should rule out? Okay, you can't say that every person who's having a palpitation or anxiety is saying it as a panic disorder. What are things that you should rule out? Any idea? Excellent. Heart is MI, angina. Excellent. For lung, it is what? A person with similarly having with excellent asthma, COPD, pulmonary embolism. Yes. Anything else? Anything else? Excellent. What thyroid? Dr. Hypo or hyper? What is more common? Hyperthyroidism. Okay. Next. Anything else? Something related to a diabetologist? Anything related to something related to a diabetologist? Excellent. Carcinoid. Anything related to a diabetologist? Diabetologist. Excellent. Hypoglycemia. And another thing is that alcohol and benzodiazepines withdrawal I've seen a lot of people saying that, sir, I'm feeling very anxious. I stopped alcohol just 1 day before. I'm feeling very anxious. There some mimics a panic substance. First thing you should rule is, what is, are you taking any substance and you have stopped? Are you taking any increased amount of substance? Because cocaine, amphetamine, lot of, when I was in like when CMC Vellore and Jipmer, lot of medical students, okay, who have used cannabis for the first time will present like panic attack. Okay, cannabis, cocaine, amphetamine intoxication, alcohol, benzodiazepine withdrawal, cocaine, amphetamine, cannabis intoxication can present with panic disorder. Now, what happens is panic disorder is, okay, I have a increased heartbeat. Now I start feeling that, oh my God, I am having increased heartbeat. It means that I have an heart attack. What happens if I get admitted in an hospital? Everybody will know. And like, what happens with my family? What my family will be in roads. I need to pay a very big hospital bill. All my savings will be lost. So what happens is that you keep on thinking the worst that is possible. The worst that is possible. Okay, that is a distress, and that is called as catastrophization. That is called as catastrophization. You think the worst is going to happen. That is called as catastrophization. Now, what happens is that I have an increased heartbeat, okay, and I feel that the worst is going to happen. But I'm going to have a heart attack. All my savings is lost. My family is going to be in the roads, and nothing is going to happen. There's no future, and you feel bad. Now, what happens? It's a sympathetic, more simulated, and there will be more increased palpitations. It will be running as a circle. So, what is a very important thing is that, as in a therapy, what is the thing that we do in therapy is, in panic attack, we do catastrophization. Okay, we tell them, whenever there is an increased heartbeat, try to normalize it. Sometimes it is okay to have increased heartbeat, or you feeling a heartbeat. That heart keeps on beating, but only sometimes we feel it. So it's quite normal to have it. So please do not feel bad about it. So we'll just try to normalize it, so that the patient won't think about the worst that is possible, and that prevents further sympathetic stimulation and all that circle that's happening. And that technique is called as decatastrophization, trying to normalize and also decatastrophize this thing so that the patient doesn't feel bad. That is called as panic attack, the panic disorder. Now I want to know, what is the treatment? This is a therapy part. What is there any medications that is specifically available for treatment of panic attack or panic disorder? SSRIs. All SSRIs can I use, or is there any particular SSRI that I'm going to use? Paul Jason G. Venlafaxine. Is venlafaxine as an SSRI? Fluoxetine. Paul Jason, am I going to use fluoxetine for this patient? Any thoughts? Imipramine. Panic attack. What is the drug that we commonly use? Paroxetine. P for paroxetine, A for alprazolam. Why am I using paroxetine? Paroxetine is also an SSRI, but when all other SSRIs are a bit stimulating, okay, paroxetine is as a calming effect. Already this patient is having increased panic symptoms, right? So you need to make sure the patient is calming effect. Paroxetine with alprazolam, because to decrease the anxiety. Alprazolam. Is this clear? Excellent. Paroxetine and all, when we use it in clinical practice, we have a lot of side effects. Main side effect will be sedation. Yes, I accept. So what happens is that you should be very careful in answering the questions that is related to therapy. Okay. Psychoanalysis, you should have said that famous 5. What are the famous 5 I told you? Psychoanalysis, what are the famous 5? We have only 1 minute. Come on. Couch technique, free association, transference, counter-transference, psychosexual stages of development. Do not forget about it. Transference, do not make a mistake. Somehow the examiners are started developing good interest about psychoanalysis. So please make sure that you answer. CBT, VIVEK. What is that? Albert Ellis gave what? Albert Ellis gave what? REBT. Who gave DBT? Who gave DBT? Marsha Lennon. And systematic desensitization and flooding is used for Phobias. Excellent. Can we go for questions? We have another 5 minutes. Okay, I think it's visible. Most common psychotherapy used for depression is cognitive behavioral therapy. Any doubts? Any doubts? Please make sure. Okay, these are all simple questions. Try to read all the choices. Please read and answer. What is the type of therapy used in borderline personality patients? Excellent. DBT. DBT is nothing but dialectic behavioral therapy, which was given by DBT was given by Marsha Linehan. Excellent. Excellent. What is the other name for borderline personality disorder? What is the other name for? Excellent. Emotionally unstable personality. Cognitive distortion. Okay, cognitive distortion in panic disorder is black and white thinking, catastrophization, labeling, mindfulness. Yes, wonderful, wonderful. You're able to make it catastrophization, worst that is possible, panic attack, mild palpitation, heart attack, I'm going to get admitted, catastrophization. What is the cognitive distortion in emotionally unstable personality disorder? If there's the same choice, what will be the answer that you're going to say? Excellent. Black and white thinking. Either you are my best friend or the worst enemy, nothing in between. Don't be like that. Just have a gray in between. Systematic desensitization was given by. Excellent. Joseph Polby. Any doubt here? Any doubt here? Excellent. A child was fearful of playing in a swimming pool. The swimming instructor just carried the child and dropped in the pool, making sure that there is another trainer who can help the child when needed. But in a few minutes, the child could find that his fear has reduced and started swimming the way he was guided. The method of therapy was called as flooding. Any doubts? Any doubts? But you should be very careful in flooding because it might itself become a stress and it might make the patient to avoid the stimulus. Next, coming to the 6th question. A female had obsession of contamination. The therapist made the child to touch a wash basin and didn't allow the lady to wash her hands. Okay. Her anxiety was increased and slowly reduced. This type of therapy is called as ERPT, exposure and response prevention therapy. 2 questions that is commonly asked is one is on transference, another is on this ERPT. Next. Okay. Therapist unconscious attitudes towards the patient during a psychoanalysis is called as. I am talking about therapist. I am having an attitude towards a patient. What is it called as countertransference? If the question is different, a patient is having an unconscious direction of feeling towards a therapist, what it is called as? You're all with me? Who is the father of psychoanalysis? Who is the father of psychoanalysis? Excellent. Excellent. Therapy used in treatment of post-traumatic stress disorder is. What is EMDR? What is EMDR? What is EMDR? Eye movement, desensitization, and reprocessing. And last, who founded the cognitive therapy? Concentrate here. Who founded the cognitive therapy? cognitive therapy. Any doubts you have? Why there's different answers here? Albert Ellis gave rational emotive behavioral therapy, REBT. Cognitive therapy was given by R&T Beck. No doubts. Nobody should make a mistake. R&T Beck. If for OCD, both CBT and ERPT given question, what to go for? Always go for ERPT. I've told my students, if option A is ERPT, T is ERPT plus SSRI, go for ERPT plus SSRI. Okay. CBT is just a generic term. ERPT is specific. It's a wonderful question. Go for ERPT. You will be given marks. Exposure and response prevention therapy. Okay. Fine. It's 7 in the morning. It's really good to have you all. It was really interactive. I didn't feel it's like on 1 hour. So thank you. Thanks a lot. We'll meet tomorrow and we'll continue the other forms of therapy also. Okay. Interpretation of dreams, dear. Dreams, kanavugal, dreams. Okay. Thank you, boss. Thank you. All the best. Tomorrow we'll meet at 6 o'clock. It's nice. Really motivating to have a class with you all. Thanks. Bye.